Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 26, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County and most of the state continues at high transmission. As all but 3 counties in Iowa are at high transmission, and most of the country, quite frankly. Our COVID case rate in the last 7 days is 139 per 100,000 population. It was 107 per 100,000 population last week. This COVID fire is as bad as the ones out west, and it continues to burn, and its fuel is all the unvaccinated people. Our local schools will be affected by the more contagious Delta variant spreading, and unfortunately, the number of cases in the 0 to 17 age range is already increasing and making up for a larger percentage of the total cases. And we know the spread will go to non-school age unvaccinated people. A number of factors influence the spread of this virus, and first is the longer you're with or in close proximity to a positive case means there's more time for it to spread to you versus a short encounter. Also, the amount or severity of symptoms influence transmissibility. If a person is coughing or has a fever and other symptoms, not only does that mean there's plenty of virus circulating in their system, the cough also provides a way for the virus to get into the lungs of those around them, and by those tiny airborne particles traveling through the air. And I think you all realize that areas with little or poor circulation can cause the virus to linger more in the air and be available for someone to breathe it in. So schools and indoor work sites and other indoor public places are where the virus is more likely to spread. Remember, even talking can spread the virus. So now that we're dealing with the Delta variant, things are a little different and require extra attention to all the safeguards we've been practicing. This virus, Delta virus, is actually better at attaching to cells in our nose and airway, plus it reproduces better, resulting in more virus throughout the body, which then makes you sick and also makes more virus particles available to spread to others. Not to mention, with continued spread, more variants will develop, and one may develop that will not be stopped by any of the current vaccines. That's why we're so concerned about Delta. Luckily, the COVID-19 vaccines do prevent this viral replication, or if it does take hold in a fully vaccinated person, it usually causes mild illness, or you may not even know you have it. And of course, remember, vaccinated folks rarely are hospitalized or die, but they still can spread the COVID to others. In Iowa, the majority of current COVID-19 hospitalizations are among unvaccinated Iowans, according to the Iowa Department of Public Health. On August 25th, 79% of individuals hospitalized with a primary COVID-19 diagnosis were not vaccinated, and 86% of patients in the ICU were not vaccinated before becoming infected. The hospitalization rate is currently highest among middle-aged to older adults. 87% of those hospitalized are age 40 and older. Children under the age of 18 account for just 2% of COVID-19 hospitalizations. On the flip side, the number of vaccinated people getting COVID is a tiny amount compared to the over 53,000 people who have been fully vaccinated in Dubuque County. Breakthrough cases do happen in vaccinated people. Remember, no vaccine is 100% effective, and the more vaccinated people in your community, the more likely you are to hear about those breakthrough cases. Why is that? Well, think about it. Dubuque has about 53,000 people vaccinated, or 55%. In contrast, let's look at Walker County, Alabama, where only 33% of their population is fully vaccinated, or about over 21,000 people. So if we do the math, 5% of 21,000 is a lot less than 5% of 55,000. So by the numbers and the predicted amount of breakthrough cases, or 5% approximately, a county with more vaccinated people will logically have more vaccine breakthroughs. Fortunately, and mostly because of our current vaccination rate, our hospitals have been able to handle the number of COVID people needing hospitalization. But it's difficult to predict what may happen in a few weeks, especially with the start of school and local colleges and universities. That's one of the things that keeps me up at night. Our hospital and healthcare capacity to manage and take care of COVID patients and keep those numbers low so that people ill with emergencies or other illnesses can still see a doctor or get a hospital bed if they need it. So for those of you still contemplating vaccination or who are waiting for full FDA approval, please don't wait any longer. The Pfizer vaccine is now fully FDA approved. And by my remarks today, I hope you get the idea that it's not just about you. It's about our community, and whether you get vaccinated or not will impact variant development and our hospital and healthcare system's ability to serve all in the community who need healthcare. It's almost Friday. You know my usual message of get outside and enjoy summer and safe activities to socialize or be active, but it is going to be a hot weekend, so drink plenty of fluids, stay out of the sun, especially during midday, and check on your neighbors or family who live alone. Thank you all for tuning in and doing your part to slow and stop the spread of COVID-19.